How many times have you had a patient with foot pain, altered gait, claw toes, hallux valgus, flat foot, high arched foot, or plantar fasciopathy, and haven't been able to clearly identify which muscle was failing? In clinical practice, the intrinsic musculature of the foot is one of the most difficult regions to assess objectively. We can observe weight bearing, analyze gait, examine mobility, or carry out functional tests. But often we still don't know whether the problem stems from a genuine deficit in muscle activation, a compensation, or a secondary overload. This is where surface electromyography, or EMG, brings about a significant change. It allows us to measure the actual activation of the foot muscles, compare both sides, detect deficits, analyze synergies, and adjust treatment using objective data. Why is it so important to assess these muscles? Because their main function is to maintain the arches of the foot, stabilize weight bearing, and contribute to control during walking. When one of them fails, the body redistributes the load to other structures, tendons, joints, the plantar fascia, or other muscles. Pain doesn't always appear in the muscle that's failing, but rather in the structure that's compensating until it can no longer take any more load. That's why directly measuring muscle activation helps to better identify the origin of the problem, and not just the area where the symptom appears. With EMG, you can assess 5 main muscles of the foot. The first is the Extensor digitorum brevis, located on the dorsum of the foot. It's important for extending the toes, facilitating push-off during walking, and keeping them in a functional position while bearing weight. It makes sense to assess it in cases of dorsal pain, toes that do not make proper contact, flexed toes, claw toes, or functional deficits of the big toe. In addition, it's often useful to also include the short flexor of the big toe to understand the balance between extension and flexion. The second muscle is the first dorsal interosseous, which is involved in controlling the second toe and in the separation between the first and second toes. Although it often goes unnoticed, it can provide useful information in patients with claw toes, difficulty separating the toes, or forefoot dysfunctions related to fine control of digital movement. The third is the abductor of the little toe, responsible for separating the fifth toe and contributing to the stability of the outer edge of the foot. It is advisable to assess it in patients with difficulty separating the little toe, pain on the outer side, or a feeling of instability while walking. The fourth muscle is the flexor digitorum brevis, which flexes the second to fifth toes and contributes to plantar flexion of the foot. It is one of the most important muscles for stabilizing the plantar arch, as it works during the stance phase and push-off when walking. Assessing it is especially useful in patients with pain when bearing weight on the toes, plantar fasciopathy, flat foot, high arched foot, or heel spur. In these cases, EMG allows us to check whether this muscle is sufficiently activated to help support the arch, or if the load is falling excessively on the plantar fascia or other structures. The fifth muscle is the flexor hallucis brevis, which is key for push-off during walking and running. It makes sense to assess it in cases of functional deficits of the big toe, such as hallux rigidus, hallux valgus, or metatarsophalangeal dysfunctions, as well as in gait or running abnormalities, or issues with the functional support of the toe. Furthermore, analysing it alongside the extensor hallucis brevis helps to better understand the relationship between these two antagonists. A deficit of the flexor may be associated with hyperextension of the big toe, whilst a deficit of the extensor hallucis brevis may encourage a sustained flexion. These muscles can be assessed both statically and dynamically. When assessed statically, we can better isolate the muscular function. Dynamically, during walking or functional exercises, we observe how they behave under real load conditions. Of course, as these are small muscles, precise placement of the electrodes and contextual interpretation are essential. Ultimately, the intrinsic musculature of the foot plays a decisive role in the stability of the arch, gait, and joint health of the entire lower limb, yet it remains a region that is seldom objectively assessed. With mDurance, you can measure the actual activation of the pedius, the first dorsal interosseous, the abductor of the fifth toe, the short flexor of the toes, and the short flexor of the big toe. Compare sides, detect which muscle is failing, understand compensations, and design treatments based on real data. Because in the foot, as in any other region, the difference between a thorough diagnosis and an incomplete one often lies in what we can't see with the naked eye. Click Request Information and discover how to use EMG to assess the intrinsic musculature of the foot from the very first session.